So Dr. Scholz, we're picking up questions from our YouTube comment section, and somebody was wondering what orgasms are going to look like after surgery versus radiation. They're wanting to make sure they maintain a good sex life here.
That's a good question. I think that the default answer is they're not supposed to change. The possibility or the capability of getting normal erections after treatment does often change, unfortunately. But the general sense is that the sensory nerves, the things that lead to the experience of an orgasm, is those nerves are not usually interrupted by either surgery or radiation. I wish I could tell people that that's universally true. It's not universally true. There are people that have had issues with changes in their sensibility and their ability to achieve orgasms after both surgery and radiation. But it's not the norm at all. Just like with anything, there are strange and unexpected occurrences with surgery and radiation that happen. I'm more concerned that they happen more frequently with surgery than with radiation. But I'm not aware of any real good quality data that can tell us how often these things happen. It's not very frequent, though.
There's an 80-year-old patient whose libido is not important to him, and so he's wondering, should he just get an orchiectomy and go ahead and just take care of it right away and not go on hormone therapy, so that since it's not a big deal, is that just a okay procedure to have?
Well, I mean, the irreversibility of orchiectomy to me is not a very attractive proposition, although it's not just libido that is impacted by having a low testosterone. It's bone health, muscle strength, concentration skills, energy, all kinds of things. And so if there is an opportunity for a man to get his testosterone back, I think in most cases that's going to be desirable. Can men that have had orchiectomy take testosterone? And the answer is yes. It's a bit more of a hassle than just having, one's own testicles making your testosterone. You can forget about it. But the people do take testosterone. Sometimes Lupron shots cause permanent low levels of testosterone. And even though these individuals have stopped their Lupron, their testosterone isn't recovering, which is very similar to what happens if you have your testicles surgically removed, which is what an orchiectomy is. It is feasible to recover testosterone, though people that have surgery are not looking to recover testosterone. But I think it's wise to keep your options open. And I'm not really a fan of orchiectomy.
So there's a patient whose PSA was 84, and then they started taking Lupron, and it went down to about 18 in the past couple months, and it seems to be continuing. They're wondering, does this mean the cancer has stopped growing?
At least initially, it's likely that it has stopped growing. The thing to look at in terms of predicting where things are and where things are going to go in the future is something called the PSA Nadir. And that is after a person has been on hormone therapy for a period of 4 to 6 months, the PSA will generally bottom out. And if the PSA is higher than 0.1, which this individual clearly has a much higher level, we don't know how long they've been on the treatment, but it doesn't look optimistic that they're going to get all the way down to 0.1. The typical PSA decline after even 1 month is about 90%. The concerns are very significant that it won't be long before the cancer is growing. It is regressing, the PSA is dropping, but there are cells in this individual, cancer cells, that are still functioning and showing their metabolic activity by making PSA. And that means if they can do that, they can grow. So it's an initial good sign, and it's almost always the case. You'll see an initial drop in PSA when people start Lupron or any form of hormone therapy. But it's important how far it goes. It's not just the initial response. It's important to get people into what we call a complete remission. That means an undetectable PSA. And those studies clearly show those people do much better than the people that don't get into a complete remission.
Thanks for watching. If you would like more information about prostate cancer, you can go ahead and subscribe to our YouTube channel. We come out with new prostate cancer videos every week. And go ahead and visit our website, pcri.org. We have tons of information on prostate cancer that will help you.